it's been crazy, and a lot of people are kind of correlating it with lung issues. But as a cardiologist, what impact is it having on a heart?
That's a great question. We were perplexed initially when we heard data that mainly came from hard-hit areas outside the U.S. initially, like China, where a lot of cardiologists were alarmed at the rates in which the disease had a high fatality rate in patients who had underlying heart and other chronic conditions. As a cardiologist, some of the risk factors for having the extreme poor outcomes from this disease include patients who've had high blood pressure, patients who've had underlying diagnosed coronary artery disease or plaque in their hearts. We see that patients who have certain risk factors such as diabetes, obesity, and also patients who've already had weak hearts called cardiomyopathy are at higher risks. Age is a factor in terms of having bad outcomes when you're admitted with this condition. 70% of patients in ICU units are mainly elderly, but we're seeing this in younger patients now who have underlying conditions. So it spares no age, but it's targeting patients who mainly have risk factors and chronic underlying conditions that I just mentioned. Lastly, patients who are smokers and have immunocompromised states such as HIV and lupus are also at risk.
And you kind of touched on this a little bit already, but you mentioned that a lot of them have underlying heart conditions, but do people have to have an underlying heart condition for it to be a problem?
No, you don't. In New York and other areas in the US, the CDC just reported data from February and March where they saw a population of young adults who had no underlying conditions. We know 1 in 4 adults will be affected by this disease. We know that majority of these patients will have mild symptoms and some will just have no symptoms at all. However, we're seeing young patients who are getting intubated in ICUs. We're seeing young health providers and nurses who are getting intubated and who are being admitted to hospital settings. So the question becomes, is it the exposure to the viral load, or did these patients have underlying conditions that were yet to be diagnosed? Research and autopsies will eventually bore that out. But my crying call to people in the Delta is that we are already a mecca of cardiovascular disease, 1. 2, we already have strapped resources when it comes to dealing with the health crisis that we're about to face, having the lowest number of physicians per capita. Hospitals are usually in rural areas, and so they're not equipped with a lot of capability to deal with the high volume that this might mandate. So prevention should be the key, being that we live in the epicenter of cardiovascular disease. And so what we need to take into consideration is that patients who have those chronic conditions like high blood pressure, diabetes, obesity, patients who have had coronary disease, if you've had kidney disease, if you're on dialysis, if you've had lung disease like sleep apnea, this virus will not only impact the lungs, but decrease oxygen flow to your organs and cause further cardiac injury, thereby worsening your symptoms whenever you contract this disease.
Thank you so much. And also, I know you wanted to touch on the flu and how relevant that still is. I know the coronavirus has kind of, outshined that lately, but the flu is still extremely prevalent and extremely dangerous.
Correct. So cardiovascular disease kills about 700,000 people a year. The flu itself, this past couple of years, has been between 30 to 40,000. In 2017, about 60,000 people died from just the flu. So that's why we mandate that every patient with underlying cardiovascular disease have some form of either their pneumovax and their flu shot records updated at all visits, checking with your primary care doctors and your nurse practitioners. And also you need to take heed that washing your hands is something that not taken lightly. These are practices that not only should be taken now, but it's something that you should have, practiced while you interact with not only your family members, but whenever you go out and interact with your colleagues, for those who are essential workers. And then you want to make sure that you keep up with your lifestyle and dietary recommendations, because this virus and other viruses like the flu do not negotiate with your risk factors. They do not negotiate with where you live. They do not negotiate with if you're a man or a woman. And so you have to take care of you, and you have to take care of your society and your loved ones. So preventative measures, social distancing is in play. Listen to your local officials and your state officials in terms of ordinances in play. And then make sure that you seek medical help if you find yourself in trouble.
All right. Well, I want to thank you so much. I appreciate it.
Thank you very much. Have a great day.